Hi, this is Adajar from XSculpt, and this video is to show you how to drain your own seroma after your ChestSculpt procedure. Now, a seroma is, as I may have explained, is a collection of fluid usually behind the nipple. And the reason why it occurs is because during the healing process, your body makes a lot of fluid. And in the chest, we removed the breast gland, which left a cavity, and that cavity filled with fluid. Now, it's not dangerous. However, it just does not, your chest isn't flat like we want it. So this procedure will take care of that. Now, a couple things. Number one, please do not do this on your own without checking with me first. I'd like to, I have to see pictures. I have to make sure that you do have a seroma, because if you poke your chest, as I'm about to show you, and you don't have a seroma, it could be potentially dangerous, okay? Number two, you may need to do this a couple of times. Sometimes guys can need to do only once. Sometimes some guys have to do a couple times, depending upon how your own healing powers are. So you may have to do it several times. However, in between sessions or after you do it, it's really important that you wear your compression to minimize the chance that it forms again. If you were to do it again, maybe give it about 2 days between aspirations to give your body enough time to build up the fluid. If there's no fluid there, please don't try to do it, because again, you have underlying muscle there. If done properly, this procedure is very safe. But don't try to poke yourself if you feel like there's no fluid there. So I will be calling into your pharmacy everything you need for the procedure. This will include a numbing cream that you'd place on your skin for the aspiration. Your incision should still be numb, so it shouldn't be an issue, but I'll send that as a precaution. It's also good if you have somebody with you, just in case you need some help. And I will be on either FaceTime or WhatsApp with you the first time if necessary, so that we can make sure everything goes well, okay? So you should be in an area with, to do the procedure, you should be in an area that has a lot of lighting, or you have a good light source. You should have a table close by or a counter of some sort, and lay everything out, okay? So first of all, take the numbing cream, if you choose to use it, and rub the numbing cream all around the nipple area, okay? And especially around the incision, because that's where we're going to do our aspiration for. Now, the numbing cream has to sit there for at least 45 minutes minimum for it to take effect, okay? So keep that in mind. Now, one of the things I'll be calling in for you is a syringe that looks like this, okay? So we're going to open this up and have it ready. Now remember, you should wash your hands very thoroughly with soap and water before getting started, okay? Okay, so we have our needle ready, okay? You'll have, get some alcohol pads and have that ready, and open this up and have that ready like that, okay? Now there will be a needle supply. You'll have a needle. Also, sometimes it's already connected to the syringe. But it will be a needle. Now, keep in mind, the needle will be relatively thick, but don't be intimidated by it. The needle has to be bigger so it can remove any of the liquid or blood that's in there, okay? And so what we do is we screw that on here, okay? Often there's a little bit of air in the syringe, so push all the air out of the syringe like that, okay? And have that ready. Get some gauze ready. You should just need 1 or 2. Okay, and then a Band-Aid, okay, and have the Band-Aid ready. So all these things should be open up and ready. If you're right-handed, it should be close to your right hand. If you're left-handed, it should be close to your left hand, okay? So that's the setup. So the procedure is going to work like this. Basically, what we're going to do is we're going to take the syringe with the needle attached, and we're going to poke it at a 90-degree angle through your skin into the fluid collection, and then aspirate it, okay? So this is how I recommend you do it. If you're by yourself, you will, the area has a numbing cream if you choose to use it, okay? You take your alcohol pad, and then you wipe this area down, okay? You wipe the area down, okay? Then you will take your needle like this and hold it in this manner, like this, with your thumb like this, okay? So you could push up like this, push up like this, push up like that, okay? And you hold it like this, okay? Because you'll be poking it like this. You can do it like this, it's a little awkward though, okay? But hold it like this. And what you're gonna do is you're gonna rest your hand, your arm against your chest wall so everything is stable, okay? Now, your nipple area here, and I'm going to be showing a video in a little bit, a little video. But basically what you're going to do is hug, your arm is tight here, and then you're going to put the needle right against your skin like this, okay? Just like that, okay? Right against the needle, now right against the skin, and you're going to put the tip of the needle right next to the incision, okay? You could even do it through the incision, but right next to the incision would be ideal. 90 degree, and I want you to direct it behind the nipple, okay? So for example, if this is your nipple and you're inserting here, I want you to direct it to behind the nipple underneath the skin so it goes like that, okay? So once you do that, you slowly insert the needle and you insert it about maybe halfway, okay? Whatever the needle length is, halfway, you insert like that halfway, and then you're going to take your thumb and then you're going to push it back like that so you see the syringe going, and it should, and if there is a seroma there, it should fill with fluid. Now, as you're doing that, your left hand is going to squeeze like that to help bring any fluid to the towards the needle, okay? Now, it's really important to keep your hand as stable as possible, okay? And that's what you're gonna do. Again, so you're gonna go like this, and then you're going to squeeze and aspirate like this, okay? Like that, okay? And pull it back. You shouldn't have too much resistance. And one more time, okay? You're gonna insert, your arm is tight against your body, and then you aspirate, and then you squeeze around like that to encourage all the drainage, okay? Now, you don't have to go for every last drop, but do what you can. Then you pull it out, okay? And then you grab your gauze, okay? And then you just press on that area, and you should have some fluid in there. And then what you can do here is take the fluid and then just empty it into the sink, like that. If you still feel like you have more fluid, then again, you repeat the process, okay? You can aspirate like that. Okay? You pull it out and you waste the fluid. So in this picture, we are showing the picture of the nipple and the black line is the incision. So to do the aspiration, you would insert your needle. You can insert your needles either in the incision or somewhere right at this blue spot, right next to it, and you direct it. Probably, I would prefer either a 90 to 45 degree angle in this direction, like that. Okay, and then if you don't get any fluid or any return, then you pull back just a little bit, and then you redirect it in this direction. And then you redirect it in this direction, okay? And remember, it's very important that you massage or compress your chest, towards the needle while you're aspirating, so that you can encourage fluid to go in that area, okay? Then, once you're done, then you wipe it again with alcohol, like this. Then you take your Band-Aid, and then you put it on like that over the hole, okay? And then you put your compression on. So that's how you do an aspiration. It can be a little intimidating the first time, but once you do it several times, it should be just fine. You shouldn't, sometimes you'll have to go deeper with the needle if you're not getting anything. Sometimes you may have to direct it in different areas like that. To get everything. You may feel a twinge if you hit the underlying muscle. That's not a problem. That's not an issue. The needle is not long enough to pierce your heart. It's not long enough to to pierce your lung, as long as you're not, you know, jamming it in you like that. So please don't do that. But you know, just enough, nice and slow. And then the key thing is the massaging with the left hand. Okay, so always kind of insert just halfway into the needle, you know, and then that's when you start directing it. Okay, and then it's your left hand that's kind of like pushing the fluid towards the needle rather than the needle moving around. But again, you may have to move a little bit here and there, but it's the left hand kind of massaging the fluid there. Okay, so that is how we do a seroma aspiration. Again, if you're nice and slow, very safe. Again, you're not gonna poke your heart, you're not gonna poke your lung or anything like that, so don't worry about it. You know, after you do your aspiration, you know, please send me a text about how much you received, the color of it, and all that. That's important to note. And then, you know, and then I'll keep in touch with you. All right. Thanks so much for watching this video. If you have any questions, you know, please send me a text, and then we'll go from there. All right. Thank you very much for watching this video, and good luck.